Welcome to You and Your Pets. I'm Jim Horton, and we're here with our resident expert, Dr. Ernest Rogers of the Maplewood Animal Hospital, and we discuss a broad range of pet issues, care issues, and other things related to your pet on this show. Tonight, I'd like to focus strictly on diabetes in dogs and cats. And what is the incidence of diabetes in dogs and cats?
Well, though it's 100% for the animal owner that has a cat with diabetes or a dog with diabetes, it's actually quite low. We tend to see it more in older cats and older dogs. But really, I would guess in my practice, I see something in the order of 2 to 5% of animals that come in with either early or late stage diabetes. And that's adult onset diabetes, so the animals would normally be adult. I have seen it in only one animal that was actually a puppy and almost died because we couldn't diagnose it.
So then the age groups that we're talking about then are primarily older pets, and they may have other things wrong with them at the same time. Is that correct?
Well, typically what we see is a cat or dog that's been doing very well for a long time, and then all of a sudden it changes its behavior. Whether that's some of the symptoms might be eating or drinking, but certainly we see the owner generally comes in because the animal is having accidents in the house. Animal has been well health trained for 5, 6, 10 years, and now all of a sudden the animal is having accidents in the house, and that's generally the presenting complaint in dogs. In cats, often we see that the owner says that they seem to be playing more in water, or when they come in, they still, normally when they come in and they've been outside, they don't have to urinate, but now they're using a litter box more. So those are typically what we see, and the age group is in the older animals typically.
So are there different types of diabetes in dogs and cats as in humans?
Yes, there certainly are. It's, as I said earlier, we do see diabetes in the young animal. I've only had one case of diabetes in a young puppy, and it was very difficult to diagnose because puppies don't tend to show the typical signs of diabetes, but I was lucky enough to diagnose it, and that would be type 1 diabetes or juvenile onset diabetes in humans. Typically that's when the pancreas and the insulin producing cells are not producing anything. The animal's born with it, and it can be related to genetics. Then we see the other type of diabetes, which is another type of sugar diabetes, which is the adult onset diabetes. We see that in animals, as I said, 6 to 9 years old, but they can be older. And they typically have a type of diabetes that comes on. It's probably related genetically to a genetic predisposition, but it can also be due to other things that we can see in these animals, such as changes in diet. Obesity in animals can also present or precipitate diabetes. And then there's a third diabetes that most people don't think about, and I've only seen 2 or 3 times, and that's called diabetes insipidus. The diabetes, the type 1, type 2 that we generally see in animals is called sugar diabetes. A lot of people know it as sugar diabetes. Diabetes insipidus is similar symptoms, lots of drinking, lots of urination, which are 2 major signs, but this doesn't involve sugar. This is due to a hormone in the brain that is not produced properly. And so that's called diabetes insipidus. Not really the major focus of today's lecture or today's discussion, but certainly that's part of a diabetes cascade or a diabetes spectrum. And it wouldn't be treated the same way as sugar diabetes, but it is the third diabetes in a line of diabetic animals.
Okay. What other diseases may present themselves with the same clinical picture and must also be considered when you're trying to determine whether an animal has diabetes or not?
Well, I think that's the important thing, that a lot of people think diabetes is pretty easy to diagnose. Everyone knows what it is. Everyone knows basically what the signs and symptoms are. But realistically, when a patient is presented to me or to any other veterinarian, we can't think, well, drinking and urinating a lot has to be diabetes. So we have to think of other diseases. Certainly, kidney disease will cause an animal to drink a lot and urinate a lot. So we have to consider that as one of the things that could be causing these signs and symptoms. There are a couple of hormonal diseases, in particular adrenal disease that can really precipitate increased drinking, increased urination. Some other diseases that cause increased drinking and sometimes increased urination is unspayed female dogs and cats, mostly dogs, where they drink excessively because they have an infection of their uterus.
Oh, for heaven's
And that can happen. Certainly, animals that have other infections can be drinking more and urinating more, but we have to consider the spectrum of diseases that relate to increased drinking, increased urination. So one of the reasons why I presented this topic, or I want to present this topic, is I don't want the average citizen coming in saying, my dog has diabetes, and the doctor does all these tests, and then it turns out to be diabetes, sugar diabetes, and he says, well, I knew that. Well, yes, you knew that, but we as veterinarians have to consider the entire spectrum of diseases that can cause that, and because each one is treated differently. And then once we know it's diabetes, then we can go ahead with the appropriate treatment.
And what are some of the tests that you do to determine what kind of diabetes or other disease that you're dealing with? I'm assuming you take blood samples.
Correct. Typically we have something, and this is the first time I'm going to mention it this season, and we started off with preventative health. And this is something that we do in all preventative health cases. If an animal comes in and it's sick, we typically do what's called a minimum database. That minimum database includes blood, x-rays, and a urinalysis. Now, if the animal comes in as a diabetic animal with the signs of diabetes or increased drinking, increased urination, we may not do an x-ray unless we suspect there's a problem with the kidneys. Sometimes we can tell that just by feeling the animal's abdomen and feeling the kidneys. If they're lumpy bumpy, we're going to do an x-ray to make sure that that's the kidneys and not poop. So typically the minimum database is urinalysis, and in the urine we're looking for glucose, which is a spillover from the blood, and blood glucose. We take blood and we look at blood glucose. We also want to make sure there's no signs of pancreatitis or any signs of adrenal disease, and which can also be confused with diabetes. So that's the reason why we do blood and urinalysis as a baseline for these animals generally.
Okay, what part does insulin play?
Excellent question. I think we have to understand that insulin is a hormone. Insulin is a hormone that's made in the pancreas, and because it's made in the pancreas, it circulates throughout the entire blood system. Insulin is a bridge. It acts as a bridge. It's a very important bridge. So let's step back and talk about glucose. You eat a meal, the meal is absorbed, and it's changed into glucose and travels around the body. Well, it travels around the body to get to the different cells. The reason why it has to get to the different cells is so the cells have energy. Cells are our furnaces. They need the energy. And instead of our furnaces at home, which use oil or gas, it uses glucose. So the insulin is the bridge between the blood and the cell to allow the glucose or the energy to get into the cell. Without insulin, glucose stays in the blood, so you have high blood glucose. And that's one of the signs that the doctor looks for when he has a diabetic animal. So the insulin bridge can be excessive, in which case you have low blood glucose, or you can have it minimally, a minimal amount, and there you have high blood glucose. That's one of the signs. So insulin plays the part of a bridge, getting the glucose from the blood into the cell so that the cell can continue to live and generate whatever it's doing. If it's a cell that generates hormones, it generates hormones. If it's a cell that works in the kidney, then it works as the kidney. But it needs the insulin bridge to get the glucose and the energy to continue working.
How does diabetes play into the lifestyle of the owner?
Well, I think we understand that the animal, whether it's a dog or a cat, is now more dependent on the owner for its survival and to maintain a good, healthy quality of life. So the owner has to be committed to the animal, and that's one of the things we find, that owners that aren't committed tend not to have very good quality of life for their pets. So the owner has to be committed to giving insulin, and that'll be twice a day, to monitoring the drinking and urinating of the pet, that'll be every day, and then to ensure that all food that's given is measured. because part of the treatment for insulin is to ensure that they get consistent amounts of food, they get it on a regular basis, fairly well timed, about every 12 hours. You can go 10 hours and 9 hours, or you can go 12 and 12, but you can't go 2 hours and then have a 24-hour break. They have to have regular food on a regular basis, regular insulin on a regular basis. So it does tie down the owner quite a bit to the pet. And when we see a good human-animal bond, we see that that's not an issue. The owner takes up the slack, so to speak, or takes up the extra chores without much of a problem. Where there's a poor human-animal bond, it's often difficult for the animal to maintain its quality of life, and we end up seeing them, unfortunately, coming back with some severe problems as a result of their diabetic condition.
Well, I know for our animal, he is an irregular eater. He will, when he puts his head down in his supper bowl, he does get on to eating, but other than that, he'll go for hours without touching anything. How do you handle that with a diabetic animal that tends to feed at odd times?
Well, I think realistically, when an animal becomes diabetic, you tend to see you generally see an increase in their appetite. Some people don't see an increase in their appetite, and that's because they've missed the signs of diabetes. Then that animal in the long term will tend not to eat as well. But in general, a lot of diabetic animals will eat well because you're controlling their insulin, you're controlling their time that they're getting their food, and we have some excellent diabetic diets that we can put in front of them that are not only tasty, but encourage them to eat. These diets are usually high in protein so that we don't have the spikes in glucose that we would if we gave them carbohydrates or if we gave them a lot of fats. So these are well-regulated diets. The animals feel much better eating them, and generally it works out well for the animal and the owner to be able to regulate all these things, and the animal tends to eat fairly well.
So other than diet, what treatments are there for diabetes?
Well, diet, there's obviously insulin, and there are multiple different kinds of insulin. I think we're going to talk about that in the next segment. But certainly monitoring the animal is the big thing. Losing weight is going to be important, although we do know that after the fact, unlike humans, after the fact, losing weight might not help an animal regain its regular status. So it's a lot of monitoring and a lot of paying attention to the animal, but insulin is the mainstay. We can't use oral hypoglycemics or tablets in dogs and cats. It just doesn't work.
Okay. Well, we have to take a break, and we'll continue with this topic as soon as we're finished with the break. And this is You and Your Pets with Dr. Ernest Rogers, and I'm Jim Horton.
Television is a powerful and influential medium that allows different groups the opportunity to produce programming that directly affects their own communities. Public, educational, and government access channels ensure that all people, regardless of race, age, gender, disability, religion, or economic status, have access to local government information and the use of a public communication forum. Make sure everyone has a voice. Support your local PEG channels.
We're back with You and Your Pets. I'm Jim Horton, and we're here with our resident expert, Dr. Ernest Rogers of the Maplewood Animal Hospital. And we have been talking in this segment about diabetes in dogs and cats. And let's continue with this discussion and ask, can pets be given oral medication for the treatment of diabetes? Like humans in some cases.
Like
right?
humans. We can, but typically it doesn't work. One of the things that we've noticed in diabetic animals, particularly dogs, insulin pills, or not insulin pills, but glucagon pills, can work, but typically the pancreas or the cells in the pancreas that make insulin are completely exhausted. They aren't going to make any insulin whatsoever. So the pills that are used in humans are pills that stimulate the cells that make insulin so that when you need it, you take a pill, the pill stimulates the cell makes a little more insulin so you're not deficient, as we know is the hallmark of diabetes. In dogs and cats, typically when they get to the point of being an adult without any insulin, or when we start seeing the signs, we never can recover those cells. It's very rare to recover those cells. So no, we can't use the oral glycemics, hypoglycemics in dogs and cats.
So that means the owner then has to look at injection right away.
We talked about how it impacts the owner, and some owners, and I have had some owners come in and say, I can't handle needles, I'm afraid of them. So yes, we have to give insulin, and unfortunately to date, the only way to give insulin is by using an injection and giving it under the skin for the animal. We can see many different kinds of insulin. Everything from Lantus, which is one of the currently used human insulins, right through to Humulin N and Humulin R, which are some of the older insulins available. Most insulins that we use in animals and in humans vary in their ability to maintain blood glucose. In other words, how long are these insulin molecules or insulin-like molecules around to maintain the blood glucose at a stable level? Let me step back and say that in diabetic animals, diabetic humans, the best thing in the world is to keep your insulin levels at a level where the glucose doesn't spike. We don't want glucose spikes. So we don't want to, for instance, have you take a big carbohydrate meal and have your glucose go up to 800. That's bad for the body. Similarly, we don't want your glucose to drop to 60. That's bad for the body. If ideally, as a clinician, if I could keep the glucose between 100 and 200, I'm happy. And that's without swings, without spikes. So typically what we want is a longer acting insulin. And Lantus is one of those that we can use as a longer acting insulin. Unfortunately, my physician friends who use this at levels much above what we would typically use in a dog or cat. And I have one horrible story where I had a clinician who came in with a cat, and he had given 15 units of Lantus to this cat, when a normal cat would take anywhere from 1 to maybe 2 units.
Ooh.
And so the animal had low blood glucose. By the time this animal had been brought in, it was brain dead essentially and was just seizing and in a coma. And though I could keep it alive, we agreed that we would euthanize it because it wasn't appropriate. So again, how does this impact on humans? It impacts because you have to monitor the food taken in, the amount of insulin given, and the signs and symptoms that are important to know whether or not your insulin's being effective.
And as a matter of the shots themselves, are they given in the same basic place, and like in the buttocks of the animal, or is it another place that you put them, or do you vary on?
Typically what we do is we have the owners vary throughout the body, and you can use 8 or 10 different locations, but try and keep it standard so that you know when you've given it, that you've done it correctly. Different places, when you give it under the skin, you have to pinch the skin. And different places, it's more or less difficult to be able to pick the skin up and go under the skin. It takes a little bit of practice, but it's not the end of the world, and most people can master it in one or two minutes. So yes, we try and limit the amount of sites to 5 or 6, and we try and rotate them so that no one site is continually stuck with a needle.
Mm-hmm. Okay. And how often should the diabetic animal be brought into the veterinarian in the initial stages of treatment?
Well, typically what I do is when I have an animal that comes in and he or she is a diabetic, I typically start them off at a certain level of insulin, say 2 units for a small dog or cat. I show the owner how to give the insulin, and the owner goes away for 2 weeks and monitors the insulin, monitors the urination, monitors the drinking, monitors the food intake, and gives these 2 units of insulin twice a day or once a day, depending on the patient. Once we've gotten through 2 weeks, I'll have them come back. We'll repeat that. I'll monitor the animal for the blood glucose, and I'll see whether or not this seems to be effective medically. So I'll look at the blood glucose. I might look at other tests, but I'll look at the blood glucose, I'll look at the urine. Then what we do is have if that's good, then we we stay at that level. If it's too high, we lower it. If it's too low, we raise it. And then the person will go away maybe for 6 weeks and come back. So initially, over a 6-month period, I might see that patient 4 or 5 times until we get him stabilized, till we know that we're giving the correct amount of insulin for his body type, for the amount of food he's eating, and for his activity level. Because activity level, again, is another factor that plays into it. Once we have them stabilized, I might only see them twice a year.
Okay. Question, is there anything like a blood glucose meter used by humans that could also be used in pet?
Yeah, there are blood glucose meters that we can use. We don't encourage our clients to use them simply because you'll get a number, but what does that number actually mean? Should you increase your insulin or decrease your insulin? And so typically we don't want to have someone, a layperson, making those decisions.
Okay.
Once we have them stabilized, we try and keep them on the same level and make sure everything else is the same. In humans, they might give themselves a little more insulin because they're going out for a meal at pizza. They might give themselves a little more insulin because they're going to be running. But in our animal patients, we can control all that. So we tend to stay at the same level of insulin, and we tend not to monitor the blood glucose at home. But yes, you can get blood glucose meters, and there are a couple made specifically for pets, mostly held by veterinarians. If the owner is insistent on monitoring the animal, we sometimes have them monitor the urine. So when the cat urinates, we give them some glucose sticks that they can stick in the urine or stick in the kitty litter, and they can look at it and compare it to a standard and then decide whether or not there's glucose in the urine. If there is glucose in the urine and there is something called ketones, which means the cells are not getting the glucose and they're digesting themselves. So ketones are a byproduct of cell digestion. If we see ketones and glucose in the urine, we haven't controlled this animal very well, and the animal is in deadly trouble. If we just see glucose in the urine, we again, knowing that it's diabetes, haven't controlled this animal very well, and we have to increase our insulin. So yes, there are glucometers and other monitoring devices, but we tend to feel that the best monitoring for the patient at home is drinking and urination.
Okay. What else does the doctor monitor for diabetic treatment?
Well, as a clinician, as a doctor, when the animals come in, I'll take a drop of blood and I'll see whether or not the blood glucose is high or low. And that's relative to when the insulin was given, how much was given, and when the animal ate. So that's the information my clients come in with. I look at it and I make my decisions. If the blood glucose is 150 and the insulin was given 2 hours or 6 hours ago, that's pretty good. If the blood glucose is 150 and the insulin was given 10 hours ago, that means maybe at some point it was too low. So I have to make my decision. So I look at the blood glucose. We have another way of looking at blood glucose, and it's sort of like glucose. It's called a fructosamine, F-R-U-C-T, fructosamine. And that is a glucose or a sugar that varies on a week-by-week basis, not a minute or hour-by-hour basis. So when I take blood and I send it into the lab and I ask for a fructosamine level, they will tell me the fructosamine is X. And if it's over 500, the animal is poorly controlled. If it's under 400, the animal is well controlled or has good control. And if it's between 200 and 300, the animal is has excellent control. And that depends, of course, it varies. The numbers vary with the lab. But that's something else we look at. We ask the clients about urination and urination, eating, and drinking. And if those all seem to be pretty normal, then we feel we have the animal well controlled. So those are the things that we look at. We examine the animal's eyes. Sometimes we can see cataracts. That's a cloudiness at the back of the eye. And if we see cataracts, we know the animal isn't well controlled. So the other things that we see sometimes in animals that we don't see, that we also see in humans, are sometimes we can see neurological problems, open sores. Those are all things that we know indicate the animal was not well controlled in its diabetes.
Okay. The diabetic animal receives a treatment for the rest of its life. How does that affect the quality of life for the animal?
Well, most animals are well accepting of the injections. The injections are used, the insulin needles are very, very fine. I've unfortunately stuck myself with them several times, and it's about like getting a mosquito bite. It's no worse than that. The animals feel so much better when their glucose is well controlled. They don't have the headaches. They don't have the dizziness. They don't have the blurry vision. They don't have the stupors. They don't have the excessive urination, the excessive thirst. They feel so much better once they realize what their owners are doing for them, that it actually improves their quality of life. They have more energy, they can walk around, and they feel better all over. And so I think it improves their quality of life once we have diabetes well under control.
But they don't necessarily understand that better quality of life comes from that pinprick that they get twice a day, right?
Well, I guess we'd have to ask them, wouldn't we? But no, I don't imagine they do, but they do know that they feel better.
Yes.
And that I don't think they put it in their head that I need insulin, therefore I should go and get a pinprick. But I think they realize that they feel better, and whatever's happening, whatever interactions they have with their owner is always positive.
Okay. So in summary, what would you like to tell our clients and pet owners about diabetes diagnosis and treatment?
Well, I think when we really look at this, diabetes is not an end-of-the-world diagnosis. Diabetes, both diabetes insipidus, as we haven't talked about but mentioned, and sugar diabetes in animals and in humans is not an end-of-the-world diagnosis. We can control them. It's relatively easy to control these diseases. We do have to spend a lot of time monitoring. We have to spend a lot of time interacting with our pet, and we have to spend a lot of time giving them insulin and making sure that they're well taken care of. We have to monitor their diet. But it is a disease that can be diagnosed easily, and when well controlled, improves the life of both the human pet and the animal pet.
Okay. So if there are any questions about this program or any other program that we've done, please send your emails to Dr. Ernest Rogers at maplewoodAH@comcast.net. That's maplewoodAH@comcast.net. And Dr. Rogers, I'm afraid we've run out of time.
If I could just make one more statement. If anyone notices these symptoms of increased urination, increased drinking, please see your veterinarian for a diagnosis.
Okay. And that pretty much sums the evening for us. This has been You and Your Pets. I'm Jim Horton with Dr. Ernest Rogers. Thank you very much for watching.